available on YouTube and our website later on today. I will be your host for this presentation, and my name is Delonte Green, and I am the Military Community Liaison in the DC Capital Region for the Barry Robinson Center. For those of you that are unfamiliar with the Barry Robinson Center, we are a nonprofit mental and behavioral health residential treatment facility located in Norfolk, Virginia, that is dedicated to serving the youth, ages 6 to 17, of military-connected families. In addition to our residential services, we also offer community-based programs that are not military exclusive, such as our substance abuse IOP, our ABA program, as well as our foster care program. If anybody has any questions about our services or programs or kind of all that we have to offer, I will drop my contact info in the chat box. And feel free to reach out at any time. Our presenter today is going to be our very own Allison Hagan, who has been working in the field of therapeutic recreation for 11 years. She received her master's in recreational therapy management from Clemson University since 2013. Allison has worked for the Barry Robinson Center to provide quality recreational therapy services to our residents. As the activities director, Allison oversees the planning, implementation, and evaluation of daily recreational therapeutic programming. This includes our equine assisted learning program and the animal assisted interventions program. In addition, Allison continues to work with various universities in the area to provide recreational therapy education. Now, before I pass it over to Allison, I just want to advise anyone that if you have questions throughout the presentation, please go ahead and type them in the chat box, and I will answer them towards the end of the presentation all at once. So with that being said, Allison, I'm going to go ahead and pass it on to you. Take us away.
All right. How is everybody doing today? So I am going to go ahead and get my presentation started. I'm really sorry. Okay, perfect. There we go. Can everybody see everything okay? Yeah, awesome. All right, so thank you, Delonte and Justin. I am excited to be here. So as Delonte said, today we're going to grow through flow. So we're going to talk a little bit about rec therapy. So we're going to talk through some of the basics. Rec therapy and behavioral health specifically, and then also even more specifically our programming here at BRC. And so since I've been here for 7 years, I have a whole lot of photos from some of our different programs and interventions. And so as we get more specifically into the BRC topics and information, you're going to see more photos thrown in, but there are quite a few thrown in here as well. So a lot of you will recognize some of the faces of past employees if you have followed us for a while, some of our old interns, as well as our featured four-legged friends that we have in our department. So just to go over some of our objectives, our participants are going to recall how rec therapy can be a valuable addition to treatment. Participants will be able to identify the parts of the systematic process of APIDE, which is our clinical process as recreational therapists, and how it is used in residential treatment. Our participants will be able to identify the importance of leisure skills and stress management and coping abilities, as well as gaining knowledge and understanding of rec therapy as a field and how it complements other professions. So without further ado, we're just going to hop right on in. So according to ATRA, which is our identified professional organization as recreational therapists, rec therapy, it means the treatment service designed to restore, remediate, and rehabilitate a person's level of functioning and independence in life activities to promote health and wellness, as well as reduce or eliminate the activity limitations and restrictions to participate in life situations caused by an illness or disabling condition. Long story short, the RT is provided by CTRS in various settings with a wide variety of clientele utilizing a wide spectrum of intervention approaches. So, even shorter of a story, we play, we promote leisure, we engage in recreation with a whole variety of different individuals across disability groups, age groups, socioeconomic status. If you can think of it, that's who we can provide services for. So a certified therapeutic recreation specialist, also known as a CTRS, or for the purposes of this presentation, I'm just going to refer to us as RTs. We are students who graduate with a bachelor's degree from an accredited university. And so that's kind of the first step of our professional identity, is the universities that we attend classes with have to be accredited. Following the completion of our university programs, we also have to perform a clinical internship of 560 hours. Now, some universities also require a junior internship of a shorter amount of time to also prepare for the field. The university that I went to, Old Dominion, we just had to do our senior internship, but we were also provided with a lot of field placement opportunities that allowed for us to find population niches or certain disability groups that we really enjoyed working with instead. Following our internships, we have to complete a national competency exam from NCTRC, which is the National Council for Therapeutic Recreation Certification. Everybody who wants to be a rec therapist or a CTRS has to take one of these exams. Following completion or passing of the exam, you are issued your number, your certification number. And so that's how we're able to track who's certified and who's not, to make sure that we're rec therapists providing rec therapy and not just activity therapists who also have a place in the professional field, but there is a vast difference between activities and rec therapy. And then depending on the state of employment, you have to acquire state licensure in order to practice rec therapy. So this isn't applicable in Virginia just quite yet. It is something that all of our rec therapists should be working towards, because it does kind of raise the bar for rec therapists in practice, but we're just not quite there yet. So how is RT different? So as professionals, we all have our elevator pitch of what do you do for a living? You know, you can make it as simple as possible or a little bit more complex depending on your audience. And so as a rec therapist, a lot of times my elevator pitch will come back with a question of, so you're kind of like OT or PT. And so I just want to touch a little bit on the difference of the two, or the three, excuse me, because we are able to work together, but there is a big difference between what we do. So OT focuses on educating individuals on the ability to engage in their ADLs independently or with minimal support, while PT is, I'm sorry, oh, here's kids outside of my office. While PT, or physical therapy, is a professional organization, or not professional organization, excuse me, is a profession that focuses on educating and assisting individuals on how to physically move independently or with adapted equipment or with minimal support from others. And so RT, we kind of combine with those two philosophies while embracing health, but not discounting illness. And so we take into consideration all the things that our clients are able to do, just as OT and PT does, without discounting the illness. So we're taking all of those things into consideration while also utilizing all of our domains. And so we are looking at the social domain, cognitive domain, physical, emotional, and we're encouraging development and improving function in all of those places. And so while OT and PT have very specific goals, and they are able to encompass all of those things that we kind of focus on as well as rec therapists, they're much more directed in their treatment modalities and their outcomes. And so RT is able to come in and incorporate the family and that person's support system in their group or community and help the individual or the family really begin to re-engage with all of the skills that they're learning either in OT or PT and RT. And so I know that that kind of got a little jumbled, and I do apologize for that because I kind of skipped ahead in my brain a little bit to co-treatment opportunities. So while OT and PT are very focused, when you bring in rec therapy, you are able to incorporate all of the skills and abilities that PT and OT are working on with a little bit of a different view or a little different of a scope. And so you're incorporating play, recreation, and leisure to also enhance those skills that might include playing games to practice ADLs, or for instance, using a therapy animal. to work with PT on balance or motor control, or crossing the brain plane, which I'll get into in a little bit. And so when we all work together, everything can kind of come together a little bit better. All right, so who can benefit from rec therapy? Pretty much everybody. Who doesn't love to play and have fun and do the things that they enjoy with the people that they enjoy being around? So some of the popular settings that you can find rec therapists are in long-term care or skilled nursing centers, psychiatric settings, excuse me, physical rehab, either adult or pediatric, group homes, community centers. Typically, when you are in the community, rec therapy is much more commonly known as therapeutic recreation. They're one and the same. And then also corrections, which is a population that doesn't get enough credit for having rec therapy, but they're doing a lot of really good work in corrections, just as we do in all of our settings. But I think it's definitely a population that's kind of up and coming in the rec therapy world as being recognized as really important as far as a rehab standpoint. So I'm going to touch very basically on the APIDE process right now because I'm going to get into it a little bit more in depth when it comes to rec therapy and behavioral health and BRC. But from a basic standpoint, APIDE is an acronym for Assessment, Planning, Implementation, Evaluation, and Documentation. And so if you work in a clinical profession, whether it's as a rec therapist, because I know we have a few of those here today, or you're a therapist or case manager, you kind of probably have a similar clinical process that you work through. And so this just kind of helps rec therapists make sure that everything flows in the same process with every single client for every single population that you could possibly think of. And it keeps everything regulated. So regardless of what assessment tools you're using, we're all making sure that our clients are being assessed. We're all making sure that we're checking and balancing our programs to make sure that everything is, continuing to grow and develop, and then also making sure through our documentation that we are meeting goals, we're keeping up with behaviors or responses to our interventions. And so really just keeping everything on a very regulated timeline. So part of the APIDE process is an activity analysis. And so as rec therapists, we use activity analysis to make sure that the activities that we're planning for our population is going to be appropriate. It gives us a chance to really break down our activities, to really look at what we need, some contraindications, and adaptations. And so I do apologize, I left off the contraindications bullet point, but I wanted to make sure that I touched on that also. And so with each activity that we're thinking about including in our population or our group settings, we want to look at what materials are we going to need, where are we going to do this activity, and then the group demographics. And so following those, once we kind of lay those out, we want to look at the skills needed. So if I work in psych, obviously, for a residential treatment center, so my group demographics are going to be completely different than somebody who might work in a pediatric rehabilitation hospital. And so once we move through the demographics of looking at kind of who our clientele is, we're going to look at the different skills that are needed. So the physical skills that are needed for my clientele are probably going to be very similar to some of the skills that are needed in physical rehab. But some of the social and emotional or sensory skills might look a little different. So they're going to be the same, but the ability for our clients to present those skills or to actually engage in those skills is going to look a little bit different. And so that's where a lot of the adaptations are going to come in, and some of those contraindications are also going to come into play as well. And so I'm going to walk through just a very basic activity analysis of what it would look like for one of the groups that I would lead here at BRC. And then we're going to hop in a little bit more on rec therapy and behavioral health specifically. So one of the activities that we like to do here is emotion charades. And so I'm sure everybody's played charades here at least once in their lifetime. And so for our activity analysis, we're going to look at our materials. So we're going to have index cards with one emotion written on each card. very basic material activity. We're gonna facilitate this activity in our rec therapy room with 6 adolescent girls ages 15 to 17 in residential treatment. I left off specific diagnoses just because those can get very tedious in kind of wording when some are kind of similar to others and that sort of thing. So I just kind of left it as a blanket residential treatment demographic. So their physical skills that are going to be needed are active ranges of motion, balance for dynamic and static. So they have to be able to move around without losing their balance, as well as maintain like a seated, calm position without falling or tipping. They need to have that bilateral integration. So they need to be able to cross body planes as well as coordinate both sides of their body at the same time. They need to have endurance and then motor control, fine and gross motor, to facilitate whatever emotion they're going to be acting out for the group. So for their cognitive skills, they need to be able to remain attentive. They need to be able to concentrate on the task at hand. They need to be able to make decisions, have a moderate memory for short-term and long-term purposes. They need to be able to be oriented to the time, person, place, location. They need to be able to problem solve, and they need to be able to manage their time. And so as you all know, during charades, we have a timer, and you have that amount of time to act out whatever emotion it is or whatever it is you're acting out. And if you're not able to cognitively manage that time yourself, matching up with the timer can be a little bit more challenging because it's more of that visual piece. And so being able to do that on their own and making that connection of, oh, I'm almost out of time is really important. So physical skills, they need to understand both, social skills that are required. They need to be able to understand boundaries, physical and social. Unfortunately, in residential treatment sometimes, our adolescent girls have a bit of a challenge with social boundaries. They like to overshare. So really understanding that in this case, having those boundaries is really important. It is part of the activity. They need to be able to regulate their behaviors, demonstrate age-appropriate conversations, as well as conversation skills. So understanding that they can't dominate the conversation. They can't dominate when their team is answering or taking guesses, that it is a group activity. And so being able to also take a step back and kind of act as one of the group instead of constantly overstepping everybody. Some of the emotional skills that they might need are being able to connect to the group. That can be really challenging sometimes with adolescent teenagers, being able to connect to other people, especially if they have a degree of trauma or neglect in their life and they're feeling pretty disconnected from other people or not understanding quite how to make those connections, depending on diagnoses. And then they need to be able to label their emotions. And so while that might sound very basic to us, labeling emotions can be really challenging at times, especially those more complex emotions. And even as adults, sometimes we might just be feeling a certain type of way that we just can't really put our finger on. And so being able to label some of those emotions that we commonly talk about is really important. And then for our sensory skills, the adolescent girls need to be able to hear, whether that is with assistance or non. They need to be able to see what is going on. And then they need to they have that tactile need to be able to understand kind of where they are in space. I'm sorry, my thought just like flew out of my brain. So they have that tactile sensory need. So they're able to appropriately act out what is going on and also be able to understand kind of where they are in the room and within the activity. And so some of the contraindications for emotions charades, and I apologize again, I left off the bullet point, would be somebody with disassociative episodes. And so we want to make sure that those who are participating in this activity are going to be appropriate for it. So somebody who is commonly disassociating at this point due to either psychosis or an extreme mood disorder, might not be the best fit for this activity. And so if that were to pop up, one of the adaptations that I might be able to make for that is to check in with their therapist, kind of do some back homework to make sure kind of what to avoid as far as emotions or triggers for that individual, or coming up with an alternative role for them in this activity. So allowing them to kind of be the judge, so that they can still kind of get the impact of watching people act out the different emotions, but also not having to act a different way than what they might be feeling in the moment, which could cause them to have an episode. So some basic adaptations that you can do for different groups based off of your activity analysis would be basic emotions versus complex emotions. So are we going to just do the basic happy, sad, mad, or are we going to do more complex emotion cards, such as feeling disappointment or feeling overwhelmed, and kind of talking about what those emotions might look like and feel like ahead of time. So then we can change the length of time for the turns. Also, we can make it much shorter or much longer. We can allow for props, or we can allow for a participant-led activity, like I just mentioned. And so there's tons of different adaptations that you can make once you go through your activity analysis, depending on your audience or your group participants. And you know, we're kind of limited here with our time, so I didn't want to get too far into this. But one of the following steps to an activity analysis is to do a task analysis, which dives a little bit deeper into the different tasks that are required during this kind of activity, as far as how to actually engage in the activity step by step, to make sure that all of the steps are fully able to be completed by your participants. All right, so that's a little bit of like a brief, what is rec therapy intro. I find it sometimes to be a little bit easier for me to talk about rec therapy and behavioral health and BRC, because I have very concrete examples of what I can do. And so because of that, we're just gonna hop right on in. So rec therapy and behavioral health. So let's play. Play is the earliest form of learning. So if you have a child or you've been around babies, or even young kids, you kind of recognize the different stages of play. So there are 6 different types of play. As you get into the older ages, there are some different types of play that kind of come into play, no pun intended. But these are just the 6 basic ones for the purpose of this presentation, because I am focused more on kind of that adolescent development kind of phase. And so just to recap, for anybody who might not know, or it's been a long time since you've talked about the types of play, your unoccupied play is the very basic brand new baby, newborn, that's learning how their body moves. And so you just kind of see their arms flailing or their legs kind of kicking back and forth. And so this lasts for about the first 3 months of life, where all the muscles are kind of starting to activate. Baby's kind of starting to recognize, like, oh, if I move, you know, my arm, it does this. But they're not really playing with anything or with anybody. So from about 3 months on, you start to see that play start to develop a little bit into solitary play. And this, as the name is very obvious, this is when kids start to learn how to play by themselves. And so they're not really interested in playing with somebody else. It's a lot of rattles or shaking toys. They will play if somebody's sitting next to them, but it's not, you know, this interactive kind of ideal play that a lot of older kids will engage in. And so that lasts, like I said, up until about 2 years old, when around 2, spectator play starts to develop. And spectator play is when a child begins to watch others playing, but still kind of plays by themselves. And so they're interested, and so you might catch them watching a little bit more, but you know, they're still gonna kind of play by themselves, not really interested if kind of you put a baby next to or another child next to them, and they're still not super interested in that play. and then, or even really playing with anything that the other child might be playing with. And then after that, that kind of develops into parallel play. And so that's kind of where a lot of kind of what we would assume to be like toddlers playing together. But they're not really playing together. And it kind of looks a little silly at first. So you have like 2 buckets of Legos and 2 toddlers sitting side by side, and it kind of looks like they're playing together, but they're not. But they're playing with the exact same thing. But they have zero interest in playing with each other still. And then as a child continues to develop and continues to develop their social skills, that's when we move into associated play. So associated play is a playground, more or less, is our setting. And you have a bunch of kids running around, and they look like they're playing together, and they might interact here and there at the monkey bars or at the swings, but it's really they're just playing with the same things, but not really together at this point. And so that's where you see about 3 to 4 year olds at, give or take. And so the goal after our associated play development is our cooperative play. And so that is where we want our kids to be able to share items that they're playing with, engage in the same activities. So if they're coloring together, kind of sharing those markers, sharing the book, and just taking their pages out, and really being able to engage in healthy relationships through that play. And so if you know anything about trauma and development, you understand that as traumatic events happen, it can stunt growth and development. And so if continued trauma is happening to a young child, whatever it may be, that continues to kind of stunt that development of that child. And so, for example, here at BRC, a lot of our little kids kind of get stuck in that parallel play, associated play phase. And so as a rec therapist, we're doing a lot of teaching on how to cooperatively interact and cooperatively play together and how to do things together, because whatever trauma or neglect has happened in early childhood, it's kind of halted that play development. And so we want these kids to try and learn how to do these things and kind of catch up to their peers. So by the time they're, 7, 8 years old in the next year or two, we want them to be not quite as behind. And so we don't want them just playing Legos while everybody else is over here building with blocks. We want them to really be able to come together and also be able to engage in playing with those blocks with those other kids. All right, so common sessions that you're gonna see in behavioral health. We have groups. So as rec therapists, we're trained to do large groups, small groups, medium-sized groups, as well as one-to-ones, or even 2-to-1s, depending on the clinical needs of our clients. And so some of the types of interventions that you might see are animal-assisted interventions, team building initiatives, social skills and cooperative play, sports, fitness is huge, relaxation and stress management, creative expression, community integration, and then leisure education. And there's a ton more that I could go into. So another one that pops into my head right now is bibliotherapy, which is the utilization of books as an intervention, which can be really beneficial in behavioral health as well. And then some common RT outcomes for behavioral health. We really want to look at an improvement in physical health. So there has been a lot of research that shows that physical engagement in activities, not necessarily sports or fitness, but just those more physically involved activities, can help rewire brain synapses, which is a really cool science neuro facet that I would love to get my hands into more. But it can help to, like I said, rebuild those brain synapses so that we're rewiring the brain. And so a lot of our kids do get a lot of physical interventions. And so I think in behavioral health, it's really important that we do tie in those physical aspects, even though there is room and definitely benefit to some of those other interventions that I mentioned. And so we want to improve physical health so that our clients and residents can feel like they can actually engage in these things, but then also feel the physical benefits after it. So they're, as somebody who is moderately healthy, and I do like to exercise, sometimes there's nothing better than after a bad day, going home and working out. And if working out isn't your thing, then maybe it's going for a hike, or going for a swim, and just kind of feeling that sense of woosah, because you get your happy chemicals running, you have felt that physical challenge, and you've worked through it. It just kind of brings you down from the day. And so we want our clients to be able to really recognize how good it can feel to be physically active, and how it can play a part in our mood. And so then that kind of ties into that psychosocial status. And so we want our clients to be able to feel better about themselves. We want to improve confidence. We want to help them understand that they can achieve the things that we all have faith in them to be able to achieve. And so I'm going to talk about flow here in a few slides, but really recognizing and helping our clients find activities that are going to help them recognize, like, hey, I'm really good at this and I can continue to do this on my own. And when I go home, like, I can, like, Miss Allison helped me find a way to be able to do this, and you know, my mom's going to drive me every weekend, or my roommate's going to take me and we're going to go do this together. So really helping them find that group, so that they can continue to participate in that specific leisure thing that is making them feel so awesome. And so it might be an art class. It might be yoga. It could be a dance class. Who knows? It could be anything. But as long as they're really starting to feel really good about themselves, that's what we want. We also want an improvement in cognitive status. And so we want to assist our clients in, you know, working on that cognitive recall and really just assisting them in developing cognitive pathways and brain pathways as much as we can, by challenging them. And granted, there are a lot of populations where this might be a little bit more of a challenge. And so I just want to remind everybody that we are kind of talking about behavioral health at this point. And so with the cognitive status, you know, just making sure that our clients are recognizing, you know, this is how I can make sure, you know, that I have X, Y, and Z done. You know, teaching them how to organize their time appropriately with their leisure interests woven in. And so just really helping them to recognize, also just thinking more clearly and how leisure can help us clear our brains out, and just really help to remind us, like, oh yeah, I have to do this when I get home from working out today. You know, and then help, you know, just maybe keeping a checklist on their phone or in their bag. And then also we want to reduce stress management and improve coping skills. And so, like I said, you know, really tying into that physical health and that psychosocial status piece, there's a lot of research out there now that identifies leisure and recreation in behavioral health as like a huge stress management technique. And so I'm not just talking about the typical meditation, yoga, progressive muscle relaxation, that sort of thing. Like, just in general, recreation can be such a huge stress reliever for a lot of people. And it can be a positive coping skill. There's some research out there now that kind of ties risky behaviors to predisposed genetics, which is actually really interesting. And so people who engage in risky behaviors are more likely to, you know, have injuries and that sort of thing. And so if we can find them positive, kind of not risky, but more adventurous outlets for their recreational tool bag, then we're able to give them that outlet for that coping skill, so that they're that big adrenaline junkie. Then they're able to, you know, say, like, cool, I can go rock climbing, and I have this rock climbing group that I can go to like 3 times a month. And so, you know, just being able to really focus some of those needs and those personality traits into their recreation. I kind of got sidetracked with risky behaviors. I'm sorry. So back to stress management and coping skills. While there is definitely a place for structured stress management, relaxation techniques and that sort of thing, which are hugely beneficial in behavioral health, especially with anxiety disorders, and, you know, utilizing different types of yoga to increase heart rate and bringing up mood and endorphins. You know, just sometimes coloring can be a huge stress management tool. I know a lot of adults here on campus love to color. I personally like to do puzzles when I'm stressed out. And so just helping our participants and our clients learn, like, what I like to do can be healthy, you know, and I can replace these maladaptive behaviors and kind of some of the things that I've been doing, you know, whether it be drugs or, you know, risky choices, I can replace them with these positive things that I really know how to do, but I have to be cognizant in recognizing it's time for me to do this. And so really teaching how to do that as well. And then just increase leisure participation. And so as a rec therapist, one of our main goals is we just want people to be able to participate in leisure and recreation. It's something that we're all passionate about doing. I think everybody should participate in leisure more often as it is, regardless of if they have any sort of diagnosis or not. And so our overall common goal, probably, and our biggest outcome goal is to have people participate in leisure. Behavioral health, we see a lot of anhedonia and just a lot of people who quit on the stuff that they just feel like they don't have an interest in anymore, because whether it be their mood or their anxiety, or other social impacts that are happening in their lives, they just have pulled back from everything, and they think, you know, I'm not worthy of participating in this thing that used to make me feel so good. And just encouraging them to try again. You know, leisure doesn't always go anywhere. Sometimes it's about finding a new way to do it. Sometimes it's about finding a new group of friends to do it with, but it's still there. You know, it's still able to be a part of somebody's life, whether they feel that they are worthy of it or not. And so I think as a rec therapist working in behavioral health, that's probably one of my favorite things to help our kids learn, and our clients learn. And yeah, I saw Amanda is present today, and I used to work with Amanda, and a while ago we had a young lady who did gymnastics at home and just kind of fell out of it. And then while she was here, Amanda helped her get back into gymnastics. And, you know, Amanda's helped a couple of kids try out for volleyball at their home schools. And so that was really cool to watch happen for these girls who thought, you know, their dreams of playing high school volleyball were gone because they were hospitalized and had to come into treatment, just to realize that they weren't necessarily too far gone. All it took was a little bit of work on both ends, and opening it up and communicating. And so it's really cool to watch that happen with our youth. Unfortunately, it's been a very long time since I've worked with adults. And so I don't really have any personal stories about working with adults anymore. But like I said, just really making sure that we have that leisure participation increased or re-interest. All right, so I know I had mentioned finding flow. Mr. C, Dr. C, we're gonna call him that. I have not been able to pronounce this gentleman's name since undergrad, and I do apologize because he is an incredible man who researched and discovered the idea of flow. So we're gonna call him Dr. C. I did some research in the 1960s, and it led him to this theory of people, when they're completely immersed in something that they really, really enjoy, it provides this incredible mood booster. And that is the most basic frame of flow. But I don't want to get into too scientific terms and, you know, pulling out all of his research and that sort of stuff. And so the idea of flow is a complete immersion in something that is both of interest to you, but is also providing a challenge. And so I'm going to talk a lot about this picture more because it is the perfect example of flow. And so flow is also a dynamic state. And so we want anybody who's participating in leisure to understand that if they are engaging in something that they really enjoy, if it's too easy for them, they might not be the most interested in it anymore. And that kind of stinks, right? Nobody likes to think that they've just like mastered their recreational outlet. While that can be really cool or just really easy sometimes because, you know, you just don't have the brain power to do it. I personally enjoy it much more when I'm like, man, I got a new puzzle and instead of 500 pieces, it's 1,000. And that sounds really overwhelming at first, but I also know that I'm going to enjoy it. And so we want our clients to feel challenged, but to also know that they can do it, because we want everybody to always, you know, have a success plan. We don't want anybody to feel like they're failing, that the challenge was too hard, because especially behavioral health, they have faced so many challenges and just barriers as it is, that we really want to give them that sense of success. And so this picture specifically, this is one of my old interns, Hannah, and she is doing a one-to-one, as you can see. And so this activity, they were creating their own mandalas. And so this young lady really, really enjoyed doing, or coloring, excuse me. And so we decided to step it up a notch, and we pulled out some mandalas. And so she felt challenged. Depending on the mandala, you know, it was too easy or it was too hard. And so Hannah came up with this really great idea to have her create her own mandala. Now, this young lady had some fine motor issues, some coordination issues, and so it was a challenging effort for her, you know, but we were able to stick by her, and we were able to give her some starting points to work off of, so that she didn't feel like she had to create this whole mandala on her own. And so once she got to a certain point, she found her rhythm. She found her flow. So she got started with the prompts, and then she kept working, and she kept working, and then she started to come up with her own ideas, and then she started to put twists on those ideas, and then before she knew it, she was done, and it was time to color it. And you know, at the time it was, oh, that was so hard, you know, there wasn't a whole lot of positivity coming out of her about the activity. But Hannah was, of course, you know, very encouraging, very uplifting. You know, you did it, you rose to the occasion, we were here to support you, and you asked for help when you needed it, that sort of thing. And so as she worked through that challenge over a couple of weeks, she eventually got to the point where she was able to color it. And so that coloring piece in her mind was the reward. And so she thought, well, hey, I did all this hard work, now I get to do the reward part. But what she didn't realize is that she was completing her whole task, which was to work through, you know, all of these different challenges. She did have some Charades dyskinesia kind of stuff going on, and, you know, combined with the fine motor control, it was a challenging activity. And so in her mind, it was just hard because she kind of didn't want to do it. It seemed really overwhelming. But she overcame a lot of different obstacles within having to complete this completely independently. And to watch her really hunker in after she moved on from the prompts and started doing things on her own was pretty impressive. And actually, I'm going to talk about this same young lady in a couple of other slides. And so to watch her move through sessions in rec therapy during her stay here was really, it was awesome. Our intern at the time did some really great job, really great work with her. And so I just really want to touch on leisure and stress coping as far as finding flow, to kind of bounce off of that leisure participation from a couple of slides ago with our outcomes. And like I said, there's a lot of research coming out about how recreation and leisure can be so beneficial for leisure, or excuse me, for stress coping. You know, if you think about it as adults who are not in behavioral health treatment, we have the ability to pick and choose and freely go about engaging in our recreational pursuits, whatever they may be. kind of whenever we want to. And so it's our job as the work therapist to assist some of our clients in finding those activities that really do help them kind of reduce their stress. And so, like I said, bibliotherapy can be a really great intervention, and I don't really talk about it in this presentation. And so I'm just going to kind of touch on it real fast. And for people who really enjoy reading books, that can be an awesome escape after a rough day. You know, you have a rough day at the office, you go home, you make a cup of tea, and you settle on the couch with your book. And the next thing you know, 2 or 3 hours have gone by, and you feel so much better. I would not know from experience at all. And so, you know, I think in engaging individuals in behavioral health to look to bibliotherapy or just to reading books about things that interest them can be a really good coping mechanism. It can allow them to kind of distract themselves if they're having any sort of craving, if they're having some kind of a moment of anxiety, or any sort of overwhelming emotion. It allows them to escape in a healthy way, and not necessarily, you know, tracking down their drug of choice, or, you know, engaging in what otherwise might be known as risky behaviors. And so utilizing books and teaching certain clients that books are able to be used as a positive outlet can be a really good way to reduce that stress and to reduce that anxiety. And, you know, it doesn't have to be expensive. There are tons of free book libraries out there these days in different neighborhoods, and teaching our clients, you know, that there's also the local libraries, you know, and so that books don't have to be, you know, have all of these barriers. Now, of course, there are contraindications, and there are contraindications for a lot of things, and probably most things out there in life. And so I just kind of picked bibliotherapy to kind of touch on today. And so we want our clients to be able to have that sense of control over their emotions, and, you know, recognizing, yes, I am feeling anxious, I can read a book right now. That, like, this is what I can do to help me to distract or reduce my anxiety, is I can read 3 chapters of my book. And so teaching them that they can name their emotions, they can figure out their plan of attack, more or less, and then they can engage. And if they need to, they can set that boundary of 3 chapters, and then I am done. Then I can check back in with myself, and depending on where I'm at, I can move forward to option A or B. And so that also can help develop that sense of confidence. Like, I can set boundaries for myself. I can work through an anxiety attack by myself. I can do it. If I want to join a book club and discuss the book at the end of the week, I can do that. And so, you know, there's a whole lot of different branches that can come into stress coping. And so I'm more than happy to continue to talk with anybody who wants to talk about that after this. But for the sake of time, I do have to move on to rec therapy at BRC. And so this is probably my favorite part, so bear with me. I get really excited when I get to talk about our animals. But before I can get into that, I have to talk about our assessments and planning. So this is that API process that I was talking about. And so here at BRC, we use 3 different assessments. We have our CERT Psych R, our Factor R, and our Free Time Boredom. So the CERT Psych kind of does an overview of recreational participation here on campus. It's an observational assessment of just general group and individual presentations. Then our Factor R gives us an observational assessment on physical abilities and functioning. And our Free Time Boredom gives us a peek into what free time and boredom looked like for our residents at home. Moving into some of the planning, we look at the individual needs of the client within our group. And then if we need to look at recommendations for individual rec therapy services. So individual rec therapy here at BRC is common, but it is not recommended for everybody. It just really is dependent on the observational period during the assessments. So our planning and implementation, our kids hop right in once they're admitted with coming into groups with their dorms. We have a 10-day observation period before we start that initial treatment planning, just so that we can kind of get an idea of what's going on with treatment goals. Our group programming looks at group needs and individual needs. We like to take previous leisure interests into consideration, but also we want to encourage new activity exploration. We follow the same pattern with each session, whether it's individual or a group. We like to do an intro where we do a group check-in, we introduce the activity, we talk about how it relates to treatment individually. If a child so chooses, we like to be prepared for, well, how does that connect to my treatment goals, Miss Allison? So I like to be able to pull that up also. That we engage in the activity, we're always supportive, we always want to try and provide success-driven activities. And then at the end, we debrief. So we talk about what worked, what didn't work, what could we do better as a group next time, what does Miss Allison need to change for a group next time? And I always like to keep the discussion parts of groups as less pressured as possible. I want the kids to feel like they can be open and honest about their feelings about the group session, as long as they are being appropriate, of course. And, I've just found over the years that the less pressure I put on to, direct their answers, the more likely I am to get really true good answers and responses and group discussions out of them. So some of our evaluations and documentations. So evaluation, we look at, from a rec therapy standpoint, after the group has ended, really what worked and what didn't work from our standpoint. What were the behavioral responses to group? Were there a lot of, I'm not doing this anymore, and sitting out? Was there a lot of taking breaks? Or was there a lot of laughter and smiling? Can we do this again? Questions at the end, and sometimes it even means checking in with other staff members who are present in the group. Because sometimes you really want an activity to work and it didn't quite work, but you can't quite put your finger on it because you wanted it to work really, really bad. And so just really making sure that you're checking in with everybody to really get a good sense of what the outcome of that group was. So we have daily documentation and monthly documentation. So we do our daily notes, of course, following every session that we do, whether it's individual or a group. And that talks about the response to the group, how it tied into the individual treatment goals, plans for the next session, and then we have our treatment plan updates. All right, so fun, and I know I'm running out of time. So some of our programming, we do 3 groups a week per child, including weekends. Some of the special events that we've done throughout the year are paint days, talent shows, field day. We've done a mystery dinner. We have holiday programming. We do an annual prom every year, which is my brainchild. That's my favorite event out of the year, as well as cookie decorating at the holidays. That's always my favorite also. So some of the outings that we've done is we've done campus-wide trips to the Tides game, which is a local baseball team. We've gone to the Norfolk Zoo. We've gone to the theater. We've gone to Topgolf. Oh gosh, we've gone to a variety of places over the years. And so we like to focus on not just groups on campus, but how can we get into the community also to practice skills that our kids are learning. Some of our most popular activities for day-to-day programming, toxic waste for team building. It really focuses on communication and working together, as well as our Kawapa walks, which if you've never seen a Kawapa walk, they look like giant popsicle sticks with ropes attached, and everybody has to walk together. And it can be a very frustrating activity if your group is not all on the same page. Some of our sports and fitness activities, as you can see right there, and I am getting it is time to wrap up statement. Just want to touch on this. This is Bo. He is our therapy dog. He is brand new. He is currently in training and still learning all of the fun things. And with that, I will unfortunately end our presentation.
All right. Thank you very much for that, Allison. That was amazing. You did a great job. I do want to open up the floor for questions. If anybody has any questions for Allison, we're going to try to get those in real quick before we wrap up here. Any questions? You don't all have to speak at once. I do have one question for you, though, Allison.
Yeah.
What was the Halloween costume for Bo? What's it going to be?
So, Bo is actually going to be Sven from Frozen.
Okay.
And I will be Kristoff, and he will have a little Olaf that he is going to carry around with him.
Nice. I was rooting for Batman, but.
Yeah.
Okay. Well, I'll ask one more time. Any questions? Going once. Going twice. Okay. Oh, no?
Hi, I wanted to thank you for this presentation. This is really great. I am actually a psych RN at an adolescent residential treatment facility. And do you have like a website, or can we talk offline about things that I can help with? Like I don't spend 30 minutes, hours at a time with the kids, but just different things that I can help them if they're going through their anxiety or in that moment, like they're not able to work with their direct care staff and they need me to come to nursing, but it's not physical, it's more like anxiety or disassociative and stuff like that, just different ways that I can help them in the moment. I guess that's what I'm looking for.
Yeah, definitely. If you want to, I will drop my email address in the chat box, and then if you just want to shoot me an email, I'd be more than happy to chat with you.
Have any questions? We got about a minute left. Okay. Well, I'll tell you what, I just want to thank everyone for coming out and sacrificing their lunch hour to hang out with us and learn from Allison. And we hope to see you at the next presentation. Thank you so much.
Bye.
Thanks, everyone. Have a great day.